Hello, my name is Jeremy DiGennaro. I'm a resident at the University of South Florida here at ASH to present my poster. And so this project is our eagerly awaited data regarding the post-approval utilization of Momelotinib and Pacritinib, looking at early treatment outcomes. And so the first table right here on your left is looking kind of at baseline characteristics between our two patient categories with people with Momelotinib and Pacritinib. The biggest kind of difference or highlight of this is that it's most of our patients had a longer duration of treatment with Momelotinib at a median 8.2 months versus 3.3 months with Pacritinib. And over here is highlighting our hematologic responses. And so on the left side of this table looks at the baseline hematologic parameters regarding baseline hemoglobin counts, platelet counts, how many transfusions of red blood cells they need each month. And then on the right side is the kind of the mark at 3 months. And so with Momelotinib, you can see that there was a slight increase with the hemoglobin of 8.7 to 9. The average number was much higher than the median difference. I think it was about a full point increase in hemoglobin on average, with a significant, statistically significant increase. Platelets, you can see here, pretty much about the same. And then there was a very profound improvement regarding transfusion dependence with these patients. So you can see on average, the transfusion dependence went down from 1.9 units to 0.4, which was also statistically significant. Looking at Pacritinib, there was a increase in hemoglobin level from 0 to 3 months from 8.5 to 9.1. I will say, at least in our data, 70% of the patients, for whatever reason, had to come off of the Pacritinib before the 3-month mark. So our data is not as robust for Pacritinib in terms of this data set. But the patients who were able to be on it for at least 3 months also had an improvement in the transfusion dependence from 2.4 units a month to 0.75. And so looking over, we wanted to highlight an important aspect of this project was looking at patients that were recently transitioning off of ruxolitinib prior to going on Momelotinib or Pacritinib. And our parameter for that was if they were on ruxolitinib within the 2 months prior to starting either two of these. And so you can see that the median increase in the hemoglobin levels at 3 months was a full point higher with coming off of ruxolitinib versus having no prior or no recent ruxolitinib use. Platelet counts were roughly unchanged, and then you can also see that for Pacritinib, the hemoglobin and the had really no difference, but the platelets actually coming off of ruxolitinib, there was a decrease in the platelet count, which was interesting compared to with no recent rux use. There was it was about the same. And so the main kind of point that we want to make with this project was that we did see a profound improvement with the actual transfusion dependence in these patients, which is something that in these real-world studies is very useful and improves patients' quality of life. And so something that we're planning to partner with a few other large cancer centers to get a little bit more data, but that's exciting stuff.